Welcome. Today, we're diving deep into a serious heart condition, ischemic cardiomyopathy. This is a condition where your heart muscle weakens because it's not getting enough blood supply, usually due to coronary artery disease. Understanding this condition is crucial for recognizing its signs, seeking timely treatment, and improving long-term health outcomes. Let's begin. So, what exactly causes ischemic cardiomyopathy? The primary culprit is coronary artery disease, or CAD. In CAD, fatty deposits, called plaque, build up inside the coronary arteries, which are the vessels that supply blood to the heart. This buildup narrows the arteries, restricting blood flow. Over time, this chronic lack of oxygen and nutrients damages the heart muscle, leading to its weakening and enlargement. Risk factors for CAD, like high cholesterol, high blood pressure, smoking, diabetes, and obesity, significantly increase your risk of developing ischemic cardiomyopathy. Now, let's talk pathophysiology. The insufficient blood supply, known as ischemia, triggers a cascade of events within the heart muscle. Heart cells, or cardiomyocytes, become starved of oxygen and essential nutrients. This prolonged oxygen deprivation causes the cardiomyocytes to undergo cellular damage and eventually die, a process called necrosis or infarction. The heart tries to compensate for this damage by enlarging, a process called remodeling. This remodeling, however, is often maladaptive, leading to a dilated and weakened heart that struggles to pump blood effectively. The weakened heart then leads to reduced cardiac output and consequently to heart failure symptoms. Ischemic cardiomyopathy is a significant health concern worldwide. The prevalence of this condition is directly linked to the prevalence of coronary artery disease. This means that countries with higher rates of CAD also tend to have higher rates of ischemic cardiomyopathy. It is important to remember that ischemic cardiomyopathy is more commonly found in older adults due to the progressive nature of CAD, and men are generally at higher risk than women, although this gap narrows with age as women experience a decline in estrogen levels after menopause. Unfortunately, specific global statistics on the precise prevalence of ischemic cardiomyopathy are limited, but the numbers are considerable and contribute significantly to overall heart failure rates. The signs and symptoms of ischemic cardiomyopathy can vary depending on the severity of the condition. Common symptoms include shortness of breath, especially during exertion or when lying down, fatigue and weakness, swelling in the ankles, legs, and abdomen, known as edema, persistent coughing or wheezing, rapid or irregular heartbeat, and chest pain or discomfort. It's important to note that some individuals may experience minimal or no symptoms in the early stages, making early detection crucial. Diagnosing ischemic cardiomyopathy involves a comprehensive evaluation. Your doctor will typically start with a physical exam and a review of your medical history. Key diagnostic tests include an electrocardiogram, or EKG, to measure the electrical activity of the heart, an echocardiogram, which uses sound waves to create an image of the heart structure and function, a cardiac stress test, to assess how your heart responds to exertion, and coronary angiography, a procedure that uses dye and X-rays to visualize the coronary arteries and identify any blockages. Cardiac MRI may also be used to assess the extent of myocardial damage. Taken together, these tests provide a detailed picture of the heart's condition and help confirm the diagnosis of ischemic cardiomyopathy. While ischemic cardiomyopathy doesn't have distinct types, it's often classified based on the severity of heart failure. The New York Heart Association, or NYA, classification system is commonly used, ranging from Class I, where there are no limitations on physical activity, to Class IV, where symptoms are present even at rest. The condition can also be categorized based on the left ventricular ejection fraction, or LVF, which measures the percentage of blood pumped out of the left ventricle with each contraction. A lower LVF indicates a weaker heart and more severe cardiomyopathy. Treatment and management of ischemic cardiomyopathy aim to alleviate symptoms, improve heart function, and prevent further damage. Lifestyle modifications, such as adopting a heart-healthy diet, quitting smoking, and engaging in regular physical activity, are essential. Medications play a crucial role, and these may include ACE inhibitors or ARBs to lower blood pressure and reduce strain on the heart, beta blockers to slow the heart rate and improve its efficiency, diuretics to reduce fluid retention, and statins to lower cholesterol. In some cases, procedures like coronary artery bypass grafting or TIG, or angioplasty with stent placement may be necessary to restore blood flow to the heart. For advanced cases, implantable devices like pacemakers or defibrillators, or even heart transplantation, may be considered. Preventing ischemic cardiomyopathy starts with preventing coronary artery disease. This involves adopting a healthy lifestyle, including a balanced diet low in saturated and trans fats, regular exercise, maintaining a healthy weight, managing blood pressure and cholesterol levels, and avoiding smoking. For individuals with existing coronary artery disease, early detection and treatment are crucial to prevent the progression to ischemic cardiomyopathy. Regular check-ups with your doctor and adherence to prescribed medications can significantly reduce your risk. The prognosis for ischemic cardiomyopathy varies depending on the severity of the condition, the presence of other health problems, and the individual's response to treatment. Early diagnosis and aggressive management can improve outcomes and prolong life expectancy. Research continues to focus on developing new therapies to improve heart function and reduce the risk of complications. Ongoing studies are exploring novel drug targets and regenerative medicine approaches to repair damaged heart tissue. While there is currently no cure for ischemic cardiomyopathy, advancements in treatment are continually improving the quality of life for those living with this condition. Thank you for watching.